I'm Dr. Alex Hannenberg, a TeamSTEPPS Master Trainer, and I'll introduce a training session that I think will be both enjoyable and valuable. TeamSTEPPS is a teamwork system designed for healthcare professionals that's rooted in more than 20 years of research and training experience. It was developed by the Department of Defense and the Agency for Healthcare Research and Quality. It aims to improve healthcare quality and safety by helping our teams work more effectively together. A concise summary of the program's framework is available in the TeamSTEPPS Pocket Guide. This is one of a series of training modules that allow the learner to experience situations in which TeamSTEPPS tools could be used to improve team communication and patient care. The video material does not depict actual patient care, and you will get the most out of the experience by not focusing on how the scenarios differ from your own practice, but by carefully observing staff and patient interactions and discussing your observations and improvement strategies in small groups. In this scenario, we'll observe hospital staff responding to the collapse of a patient at the clinic registration desk. Study how the team members work with one another and the patient under their care. What do they say? How do they say it? And what don't they say? Observing and discussing communication among team members is a great way to identify how TeamSTEPPS tools can be used to improve teamwork in our own clinical practice. As you watch the nearby staff step in to render care to the patient and summon additional help, please pay special attention to whether it's clear who is responsible for the multiple interventions required. Also think about when and how additional help is summoned and how they are directed when they arrive. Try not to be distracted by the details of the clinical management. While you're viewing the video, use the sheet provided to jot down your thoughts about what you're seeing and what you might have done under the circumstances. When might task assistance and mutual support have improved teamwork? Your notes will be helpful in the discussion that follows. The most valuable part of an exercise like this comes when we reflect on what we've seen and how it might help us become better caregivers and teammates. For that part of the training, you'll break into small groups so there's an opportunity for every participant to share their own observations and conclusions. Keep in mind that all of the participants in your small group are assumed to be intelligent, capable, and to care about improving. You may have questions about today's activity, and this is a good time to discuss them with your facilitator.
Are you having chest pain again?
Not really. It's just my heart pounding. It's okay. It went away.
I'm glad we're finally seeing your doctor. It really worries me when you have these episodes.
Hello. Checking in for your appointment?
Yes, a 10 a.m. appointment for Robert Ellis to see Dr. Weil.
Let me get you all checked in here. I just have some updated forms for you to fill out.
I'm feeling I'm gonna pass out.
Well, let's have you sit down. Oh my God! Help! Help! He just passed out!
Hey, you're a med student, right?
Yes, I can help.
Help him! He has chest pain and heart pounding.
What's going on? Do we need to do CPR? He's breathing. I don't think we need to do CPR. You said he was having chest pains and heart pounding?
Yes, on and off for the past week.
It's possible he's having an arrhythmia. Maybe we should get some vitals and an AD. I don't know where that is. And maybe we should get some oxygen. Okay, I can help. Let me get the AED and the mobile vitals machine.
Thank you.
Sounds like a lot of stuff. Do you need me to call for more help?
That's a great idea. Yes, call the code team.
Hi, I need the code team internal medicine clinic. Yeah, patient collapsed at the front desk. That's correct. Thanks. The code team's on their way.
You have just seen a team manage an unexpected emergency in the clinic registration lobby. We assume that they are all intelligent, capable, and caring healthcare professionals who are doing their best, as are you. Next, you'll spend time in small groups reflecting on what you've each observed in the video. Every group member shares responsibility for maintaining a respectful discussion and ensuring that every participant has an opportunity to speak. In this setting, it's important to put aside seniority and professional role and to speak freely. Each of you has something to contribute. Start by spending a couple of minutes silently reviewing your notes and getting your thoughts together. Try to come up with a few explanations for behavior in the video that you can explore as a group. Consider how task assistance and mutual support skills could have improved teamwork and communication. Then, as a group, we suggest you discuss the following questions. What was your overall impression of this scenario? What went well, and where did things start to go less well? How did the clinicians organize their work, such as sharing and assigning tasks? Did the staff appear to function as an organized team? What might cause reluctance or failure to seek support when it is needed? Use the discussion outline on your worksheet to guide your small group and be mindful of the time allotted for this activity. We found it helpful if participants rotate the role of discussion leader, perhaps by name alphabetically or by seating position. Then your group will summarize in 1 or 2 sentences what you think is the most important behavior or communication tactic to work on in your daily practice from the TeamSTEPPS principles discussed today. Your group will share this with a larger group when you come back together. We will now watch an example of the team working together and exemplifying good teamwork and communication. Consider how the behaviors displayed in this second scenario correspond to the TeamSTEPPS principles discussed today. Before you wrap up, your facilitator will take some time with you to identify the most important takeaways from this training. And remember, there are many resources available to help you learn and teach TeamSTEPPS on the program's website.
Hi, I'm Dr. Adams with the code team.
Hey, I'm the clerk who called Code Blue. The patient's Robert Ellis, that's his wife. They first checked in, he said he felt dizzy, and then he passed out on the floor. This is the medical student who first helped out.
Okay, thanks for bringing me up to speed. I'll check in with you in a moment. Okay, Lily. Get a pulse and get the AED paddles ready. Jamie, let me know if we've got a good airway. And Marie, please get an IV started for us.
Okay, Lexi, I have the AED ready and I'm getting an irregular pulse.
I don't see any airway obstruction, and he's got good respiratory efforts.
Could you get me an IV start kit? I'll get a line going over here.
Can you call the ER and let them know that we'll be bringing Mr. Ellis over in about 5 minutes? Okay, can you both give me some more information? What happened before he collapsed?
Well, we were checking in for his appointment when he started feeling dizzy.